Where we're going to pick up this time is really just kind of looking at the rest of the male reproductive system. So we talked about the testes, and really if you're looking at where the stuff is going to move to as it goes through the rest of the reproductive tract, the seminiferous tubules, they kind of straighten out instead of being this coiled and go to what I would kind of say is kind of a collection area, or you can almost think of like a train station with a lot of tubes coming into it. That is called the ready testes. There's a few ducts called efferent ductules that are going to take stuff to the epididymis, which is an area that's going to reabsorb some fluids from this, let the sperm cells mature in it. And that is right, it's a comma-shaped organ right behind the testicles. After that, there's a part of the spermatic cord is called the ductus deferens, which is the tube that's going to take this materials and loops it up into the body over the back of the bladder, and is going to meet up with the rest of the reproductive and urinary systems, which is that ejaculatory duct into the prostatic urethra, and then it's the same pathway that we saw for urine exiting out of the body. So this is again showing you those different lobules, again thousands and thousands of these in here. This is that ready testes right here, that kind of grand central station where it all meets together, and then you can see efferent ductules that are going to take stuff to the epididymis, which is about 6 meters long of tubing that is then these sperm cells mature and reabsorbing some fluid out of there. It is then going to, again, as you can see here, head out that ductus deferens or vas deferens. So if we're looking at the epididymis, like I said, it's about 4 to 6 meters long, coiled up here. The sperm cells mature in here. If they were to be released too soon, they wouldn't be functional, and if they're in there too long, they also become non-functional. It is lined with pseudostratified columnar epithelium, has these long, really long stereocilia or microvilli that are absorbing fluid. You can see this a little bit right here, those cilia right here, and you can see spermatozoa in the interior. Decent amount of smooth muscle surrounding these tubules that can help propel the sperm out into the ductus or vas deferens. And you can see the vas deferens, it is a tube lined with, again, some pseudostratified columnar epithelium. You can see it's a very muscular tube. This is what's, during ejaculation, is going to move these fluids from the epididymis up to the rest of the male reproductive tract. So we see a couple layers, 3 layers actually, of smooth muscle in this one. Very much strong peristaltic movements that can make this fluids move up to the rest of the male reproductive tract. If we were to look at the urethra, which is what this is going to go into next, the urethra is lined with either pseudostratified or stratified squamous, depending on where we're at. Further up the urethra, it will be mainly pseudostratified. As we get to the terminal end of it, it is going to be that stratified squamous because it's open to the outside like most other mucous membranes. So really the last stuff to look at here is going to be these accessory organs, things that are making some of the fluids that become part of semen along with what is coming from the testes. Really on these ones, we're not doing a lot of cellular identification. It's really just being able to recognize this gland and what gland it is. So first one here, we'll see the seminal vesicles. You can see that ductus deferens loops, like I said, up and over the bladder. The reason why it's looped over the bladder like that has to do with the fact that these cells start about where the ovaries do in the female, and during development they descend to the scrotal sac. Because of that, there is a tube that actually loops up and around over the ureters to the bladder, to the back side of the bladder. You can see the prostate is underneath the bladder, and it has part of that ejaculatory duct as well as the prostatic urethra passing through it. And again, you can see another view of this right here. One of the things that talks about the seminal vesicles, they're almost more of a diverticulum of that vas deferens, meaning kind of an outpouching of it, a little dead end sac off of that. So what is going on here? This duct is kind of coiled up in there, and it is going to make something called seminal fluid, high in fructose, as well as some alkaline fluids. It's about 60% of the fluid that's going to become semen. And this is kind of what it looks like. Like I said, kind of the coiled up gland. You can see all this epithelium surrounding this space, and here's the lumen, excuse me. So if we're looking at these ones here, epithelium, like it says, they're pseudostratified, columnar, or just some simple columnar epithelium, depending on what we're looking at. There is a decent amount of smooth muscle in the outside of this gland that can contract and expel the contents during ejaculation. And again, not surprisingly, underlying connective tissue beneath that epithelium, that lamina propria. The prostate is the other one here. Makes prostatic fluid, milky fluid with some lipids and enzymes. It's about 25 to 30% of that semen components. There is 3 different zones of this one that all empty into that prostatic urethra. Like it says here, that peripheral zone is the one most likely to have issues with prostate cancer. If you're looking at it, you can kind of see it right here. You can see the seminal vesicles are behind this. You have those ejaculatory ducts right here that are going to pass through this, along with the prostatic urethra passing through it. And all those components basically inside of the prostate are going to meet together and start heading stuff out through the urethra. And if we're looking at this one here, you have a lot of kind of connective tissue and smooth muscle surrounding. Again, these organs are both contractile organs. During ejaculation, they are going to contract to force the fluids out. So lots of smooth muscle in both the seminal vesicles and the prostate. Again, the epithelium, looking at either simple columnar or pseudostratified. Really on both of these ones, and we'll take a look at them. I just want you to be able to differentiate prostate from the seminal vesicles. That's it. So we're not going to be identifying the different cells or anything else like that. I mean, I might say, like in this one, what type of epithelium is it? It's simple columnar right here. But outside of that, we're not going to do anything else too crazy. And again, lots of smooth muscle surrounding all these little openings that can help to contract and force those fluids out. The bulbourethral glands are Cowper's glands. These secrete a mucus that lubricates and cleanses your urethra prior to ejaculation. We're not going to take a look at these under the scope. Just know what they are. And really the last stuff I kind of talk about here is going to be really, at least histologically, the erectile bodies of the penis. Real quickly, semen is the composition of the fluid that came from the testes, the seminal vesicles, and the prostate. It's really anywhere from, like it says there, 1.5 to about 3 milliliters. Sperm cells, really, like it says there, between 40 and 300 million on average, about 200 million per milliliter. And it's really the combination of all those different glands. It is then going to pass out through the penis. The penis, at least histologically, is a little bit interesting in that it has these 3 different erectile bodies within it that you can definitely see histologically. So you have the ones that are on the dorsal or the upper part of the penis. Those are the 2 corpora cavernosum. Then you have where the penile urethra is traveling, which is through another erectile body called the corpus spongiosum. We're going to see there is in these erectile bodies, there is, at least especially the corpora cavernosa, there's going to be a centralized artery, and then you have venules surrounding these things that drain those spaces. And then there is that tunica albigenia, this tough, in terms of the penis, a tough fibrous connective tissue surrounding these, especially again on that cavernosa. It's a very tough, thick connective tissue layer. It's a little bit more elastic around the spongiosum. Again, needs to be able to expand a little bit more because of the fact that the urethra does pass through that. You don't want it to be too rigid in that it would seal the urethra. So if we're looking at it right here, and I always kind of say it kind of looks like a bug's face, looks like a fly eyes and then a mouth right here. But you can see here's the one corpus cavernosum, here's the other one, centralized artery, veins along the backside here. What happens with erection is blood travels into these areas. We get a lot of vasodilation. Blood fills these erectile bodies and really inhibits flow back out. And that's going to lead up to a buildup of pressure and leads to erection. You can see on this corpus spongiosum, a little bit more elastic tissue surrounding here. Again, because that urethra, or the penile urethra, is traveling through this, and you do not want too much rigidity in there in that it would seal that opening and be if ejaculation is to take place, you want materials to be able to pass out through that urethra. So if you look at it under the microscope, you can see that tunica albuginea surrounding each of these ones, and you can see the two erectile bodies here and here. You can see there's a lot of space that blood can fill in on these ones. Where if you look at the corpus spongiosum, you can see again that space right here, but then you can see the urethra, that penile urethra right here, and you would see either pseudostratified epithelium on that one or stratified squamous if we're a little bit closer to the end. And again, you can see these open spaces here, lots of non-muscle in between and around that. The slides here, we're just really going to be trying to make sure you can differentiate the main accessory organs and know the main erectile bodies of the penis on this one. So the first slide we're looking at here is of the seminal vesicles. If we zoom in on this a little bit, as you look at this, you can kind of see at least the epithelium is either simple columnar, as you can see in a lot of these ones here, or possibly a little bit of pseudostratified. You can see there is some tissue underlying this, a little bit of connective tissue as well as some smooth muscle in there. A little bit more diffuse you will see than with the prostate gland, which they refer to as being fibromuscular. This one's not quite as much, and to me that's probably the biggest differentiating factor is going to be the underlying stroma, because both the prostate and the seminal vesicles are having a pretty similar epithelial types on the surface. So again, what I really want you to be able to do is just be able to look at this slide and say, okay, that is seminal vesicle. If we go to the prostate, you can see, if we zoom in on this one, epithelial subtypes, a little bit more similar, more pseudostratified on this one. But really what you can see is surrounding here is there's a lot less space in here, and it's really a lot of smooth muscle and connective tissue. So they refer to this in the prostate as fibromuscular. And you can see if you look at the overall gland that there is a lot more of it if you're looking at over on the side here. If we're showing a whole slide, another way to differentiate this is if we zoom back out. If we have a whole slide and we're not zoomed in on a particular area, what you can look at is in the center here, this is the urethra, and one of the things you'll notice on the urethra is this opening here, and then you can see the urethra. Oh, I'm in the wrong spot here. Let me back out again. I thought it was in the urethra, but there it is. You can see the difference in the epithelium here on the urethra, so more of that much thicker layer of some of that pseudostratified here on the surface of that. So really the last thing to look at, and the last slide that you're going to be responsible for, is looking at the penis here. So this is showing you the erectile bodies of the penis. Again, to me, kind of looks like a bug face with two big eyes and a mouth. This would be, these two circles here are both those corpora cavernosum. The one down here is the corpus spongiosum with the urethra traveling through it. That is that big connective tissue layer, that tunica albuginea that's surrounding it. You can see very thick layer of connective tissue as we zoom in on this stuff a little bit now. So you can see in here, lots of collagen, lots of connective tissue. If we look in the center of these little areas here, you can see this is that main arteriole going through the middle of the corpora cavernosum. You can see one on this side. You can also see one over on the other side if I get it to the right spot. You can see the other one right there. If we were to zoom back out a little bit here now and take this down to the urethra, you can see here is that penile urethra. And again, you can start seeing the epithelial subtype is starting to look a little bit more of a stratified squam. Nope, still columnar, pseudostratified at this point. Like I said, as we get towards the end of this, it will go to that stratified squamous, but we're not quite there yet on this one. So that will actually complete all of our shows for the semester here. So what I'd say is make sure you work through all these ones and get through this. We will have a few more quizzes to do and on to the final.